My guest joins us to talk about leading with courage in a complex and imperfect public health system. You're listening to the PHEC podcast, episode 428. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. Everyone practicing public health is demonstrating acts of courage on a daily basis. On this episode, we're going to dive deeply into the significance of courage in public health. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to the community partners, as well as the broader communities that they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. But reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will also be provided in the show notes. I am excited to introduce you to my guest on this episode. I'd like to formally introduce her to you, and then I'll connect our conversation. Dr. Kristi McClamroch is an infectious disease epidemiologist, public health strategist, and storyteller with 3 decades of experience leading research programs and people across academic, nonprofit, and government settings. She is the founder and CEO of Courageous Public Health, LLC, which is a consulting firm committed to helping women lead with authenticity, vision, and courage in a complex and imperfect public health system. Dr. McClamroch's journey through public health is rooted in both scientific expertise and lived experience. She earned her PhD in epidemiology from the University of North Carolina at Chapel Hill and her MPH and BS in mathematics from the University of Michigan. Over the course of her career, she has worked as a university professor, epidemiologist, program evaluator, youth development director, technical writer, and executive director. Her research has spanned global HIV/AIDS surveillance, adolescent sexual health, and social justice in underserved communities. She has published in peer-reviewed journals and served as a principal investigator on community-based grants, all while mentoring the next generation of public health professionals. In 2024, Dr. McClamroch launched Courageous Public Health to center healing, justice, and personal transformation as essential components of public health leadership. Through keynote speaking, workshop facilitation, and podcasting, she creates spaces where women in public health can explore their stories, reclaim their power, and take unapologetic action for equity and systemic change. Dr. McClamroch is also the host of Courageous Public Health podcast, where she interviews courageous women doing the work of public health. Her guests are change makers who are reshaping what it means to lead. Her voice is known for its honesty, warmth, and depth, reflecting her core beliefs that public health work is personal and that courage is not the absence of fear, but the decision to act in spite of it. When she's not leading Courageous Public Health, Dr. McClamroch is writing her first book, a memoir, weaving together personal narrative, ancestral trauma, and public health insight, leaning into her vision of courage, freedom, connection, and kindness, and living very much out loud. Let's connect my conversation with Dr. McClamroch right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC podcast community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. I say this at the beginning of every single interview, how excited I am to have my guest on this episode. And I mean it all the time, but genuinely giddy about having you on the podcast. Welcome, Kristi McClamroch. How are you?
I'm so excited to be here today. This is great. I'm excited to be on this side of the interview.
Yes. We are colleagues, friends, and it's been so much fun to be on this journey with her. And I'm excited that she's here to share updates and really some encouraging words with everyone. So welcome, Kristi.
Thanks for inviting me.
Yes. For anyone who's new to you, why don't you just briefly introduce yourself?
Yeah. Well, my name is Dr. Kristi McClamroch, and I am the founder and CEO of Courageous Public Health, which is a consulting firm. And it's funny. So I have a podcast called the Courageous Public Health Podcast, and I always ask my guests to introduce themselves as well and to introduce themselves in ways that they might not put in a bio. So I will do the same now that I get to be the guest. I'm an epidemiologist. I'm a mom. I'm a wife. I am definitely a public health disruptor. I am an entrepreneur. I am in the process of writing my memoir. I'm in the process of recording a pop album. I have a lot of fun, exciting balls in the air right now. And so I get to be a lot of different things.
I like that. That's very refreshing, especially in times like we're in right now.
Yeah.
Very refreshing. We have a colleague in common, Dr. Joy Washington, and she always talks about finding the joy in public health, not being dictated by what's going on, but finding the joy. So shout out to her, who's also a podcaster.
Right. Yes. Joy brings the joy. And I am also really trying to tap into joy in my life.
Yeah, I think that's great.
It helps. It helps to counter all the stuff.
Yeah,
all the junk.
Absolutely. Well, we start with this is amazing that you are at this point, but let's go back a little bit and fill in the gaps a bit. Tell us a little about when you first became interested in public health or when you first decided that public health as a career, and kind of walk us through that time.
Yeah. It's funny. I connect this back to being a 2-year-old, 1-year-old, even playing math games with my dad. My dad was an aerospace engineer, very mathy, brilliant math guy, professor. And he taught me math through these math games that really connected us. And I really came to public health through math. I went to college. My degree was a Bachelor of Science in Mathematics. That was my major. And Dr. Carl Simon was in the math department and also the economics department. I ended up doing a project with him, and it was looking at mathematical modeling of HIV transmission. And so we also connected with someone in the epidemiology department in the School of Public Health. This was all University of Michigan. And that was really the first moment that I was like, oh, what is this? This is very interesting to me. I did decide after my senior year, I wanted to continue on to graduate school. And I applied to economics, industrial engineering, and epidemiology because they all would have used my math skills. But I chose epidemiology because I really felt like that offered me the opportunity to really make an impact on people's lives. And then it was like, okay, well, that's done. I'm sold, right?
Yeah.
Public health, epi, and that's what I've been doing ever since. And it's been 30 years of public health, 30 plus years.
Now, you were in a very different position. You were leading a nonprofit, and now you are podcasting. So tell me about how you got from there to here.
Yeah. So the nonprofit that I started was called Public Health Connected. And it really came from this Facebook group, the Public Health Rockstars Facebook group, which I put together like the day after our county went into shelter in place for COVID. And I was like, oh my gosh, all this crazy stuff is going on. And I had stuff going on in my family. And so I had actually been very disconnected from my public health community and, started a Facebook group with 50 of my Facebook public health buddies and said, hey, feel free to add people. And all of a sudden, in a day and a half, we had 1,000 people. And then we had 2,000 people. Then we had 3,000 people. And there was like amazing conversations going on. That led me to start Public Health Connected, which was really about supporting people working in public health during these like incredibly, incredibly challenging times. And what I saw, even back in the Facebook group, was incredible courage of people sharing all sorts of things. I mean, there's back and forth about the science and the policy and what was happening in the field. But this overlapped with the killing of George Floyd and a bunch of other things as well. And so there were conversations that just felt so real. People were sharing things about their experience. It was the professional, but it was also very personal. And I was struck by how much courage it takes to do that and how much courage we all had to tap into to get through the COVID pandemic. So that was happening. And that sort of led to Public Health Connected. And then at the same time, I was doing a lot of work on myself. And I'd done a lot of therapy in my life, but I started working with someone who helped me go from my head and my like analytical self and really get into my body and be embodied and not just be this like floating head with a body that happened to be connected. Like I'd spent a lot of my life living that way. And the work with her name is Eva Blake, and the work with Eva helped me tap into my vision for my life. And I love to tell the story of how she challenged me to write 100 desires for all the different parts of my life. And I did that. And from that, of course, I had to go analyze the data and be like, what are the patterns? It was like qualitative data analysis of my 100 desires, which I ended up really understanding about myself, that my vision for my life is about freedom and courage and connection and kindness. That's my vision. And so what was really incredible about that was then to take this understanding of how important courage was for me and then be able to bring that into my professional life. And so when pandemic kind of slowed down, I made the decision not to continue with Public Health Connected. And it was like, I would love to start my own business. What could that be about? And you were there, like we had the conversation together and it was like, it's courage. I want to talk about courage.
Yeah. I love that story, Kristi. And thanks for opening up and connecting it for us. I think it is, for a lot of us in public health, the way that we really are passionate about the communities we care about and the causes, and that always bleeds over into our personal life. There's often a mirror. So how we care so much about our communities, that caring a lot of times overlaps into things that are important to us personally. I know for myself, a lot of why I'm in public health and why I'm really passionate about this career and the work that I do stems back to connections personally, even with family. So thank you for sharing that. I love courageous public health. Of course, I was there with you through this time, but I think my questions are more so I want to sift this out. I want my audience really hear this.
Yeah.
Why courage? Like you could have chosen anything and you could have started a podcast about anything, but why courage?
Yeah, I'm going to like breathe into that question. It's such a great question. I really believe that courage is the way forward for us in public health. And I think that courage is the way forward for me in my life. I always talk on my podcast about the difference between courage and bravery, and that bravery is about taking action without fear. And courage is about taking action despite fear. And you know what? I feel a lot of fear in my life. There are a lot of things that I am either afraid of, or maybe I feel anxious about, or unsure about. And the fear that I feel is actually an opportunity for me to take action, to be courageous and still take action. And I think that where we are in public health right now, we all have a lot of fear. And it makes sense. That's a appropriate emotional signal about what's happening in our world. And we get to take action anyway. We get to move through that. In some ways, I feel like courage makes the world go round, right? it's so critical.
Yeah, I've heard, and this is one of the reasons why I wanted you to come on the podcast and definitely talk about this, because I've seen several times in posts from our influential leaders in public health. We have several folks that are, I know, speaking personally, when I see their posts, I follow their newsletters and their blogs and their accounts because they are uplifting and they have something to say about where we are, even when it's not like it's their responsibility, but they are taking this lead.
Yes.
And it's not like they're fixing anything, but they have something to say, even when this is a mess, I don't like it, and this is where we are, but it still feels good because we're not alone. So these people I've seen multiple times where they're mentioning courage.
I noticed
taking
that too.
courage to be in public health. And I so agree with that, because across the last few months, I've been on multiple stages. I've been in a lot of rooms where our public health leaders, professionals of all ranges and phases of the journey, students. And I often think to myself, you have any number of reasons to turn and go to any other direction right now, but you're choosing public health despite how things look. And I want to protect them because we need this next wave. So it takes courage to remain in this field and to do the good work and to speak out and not just sit back and take what's happening quietly. So I really wanted to bring you on to speak about that.
Yeah, if I can just add one thing. So I've spent a lot of my life acting on my fear, right? I feel fear and I act on that emotion. And I am now at a point in my life where I understand that emotions are signals, but we don't actually want to act on our emotions, right? It's often not very helpful to act based on our emotions, but we can act based on our vision despite the fear. And that's where I think the work that I've done in terms of understanding what my vision is for my future, which of course informs my vision for public health and my vision for other public health professionals. I think that's where that come in. So it's instead of acting on my fear, I'm going to act despite my fear on my vision. I'm going to act based on my vision.
That's great. So once again, the difference between courage and bravery. Explain that again one more time.
So bravery is about acting without fear. So this is I always hear the example of the firefighter who is done this so many times that they don't feel fear. They're just yes, go in. I don't feel fear. I'm just going to fight this fire. Now, of course, if I were fighting a fire, I would feel a lot of fear. But courage is about taking action despite fear. So you feel fear and you move forward anyway. And so for me, it is very rare that I am in the arena of bravery, and it is very often that I am in the arena of courage.
Yep. Got it. That's great. Okay. So with that in mind, I know you have this deep understanding. You've also had this journey, right? At this point, you've interviewed 25 guests. You've interviewed more than that, but published.
I've interviewed more than that. Yeah, we released 25 episodes. So exciting.
That's awesome. And don't worry, if you're listening now, we're going to have links to the podcast in the show notes, but you also can just simply look it up, Courageous Public Health. But Kristi, thinking about where we are now as a public health industry and the people that listen to this podcast, I mean, we're a global audience, so it's not just the United States, but the majority of our listeners are in the United States. We've been impacted by the changes. At the time we're recording, it's fall of 2025. And so the whole year of 2025 has been I think of a lot of words, but they use profanity, and I don't want to have to change the setting on my podcast. So
it's the thing that we're not going to say.
Yeah, it's so chaotic and all over the place. It's almost like we spend so much time in shock and awe, and then also a period of time feeling kind of helpless. Like, what can we do? This is so overwhelming, and a lot of us are moving into that realm of taking action, and it's just a mixture of everything. So, speaking to our audience about courage, like, what are some things that you would like to share that you've learned about courage that could be helpful for our listeners?
Yeah, I mean, this is what's so exciting about my journey and what I've created for myself is that I am continuing to learn more things about courage as I talk to women about it, women working in public health and, choosing my guests really intentionally to, hear about different perspectives on courage. And so I continue to teach and I continue to learn, that's like where I want to be. That's like my happy place. So yeah, in terms of some of the things that I've learned and sort of, coalesced these different ideas about courage in my own mind, again, one is really thinking about fear as a catalyst. And that's really important. Like, fear does not get to shut us down. Fear does not get to stop us. Now, look, we might feel fear and fight, flight, like, what is it? Fight, flee,
flight,
fawn. Yeah. Like, we might do those things, and that's okay. That's human. That's what our nervous systems, are sort of built to do to protect us. And then we can still choose to take that fear as a catalyst and take action. And so, I mean, that's one thing that I'm really clear about that now. And I love to interview my guests and hear about all the ways that they're taking action despite fear. I mean, that's my first question. That's always my first question is like, I want to hear some examples from your personal and professional life when you've used your courage. And you know what? We all use our courage all the time. There are big ways, and then there are also little ways. And, another thing that I've learned is that courage gets to be this daily, ongoing practice. And I think it's really useful to pause in our lives and actually think about the ways that we have been courageous, whether it's, today or this past week or month or year or whatever time frame you want to use, and then be able to be intentional about like continuing to lean into that instead of leaning away from that.
So when you say fear as a catalyst, I understand what you're saying. Can you give me an example of how, because it almost sounds too easy, like I'm fearful, but how do I just move forward anyway? Like, how can we use fear as a catalyst? I think I need an example or two.
Yeah, great. So fear as a catalyst. And again, it's fear as a catalyst to move towards our vision.
Okay.
That's really what it is, right? It's like the catalyst for what? Move towards our vision. So for me, you know this, Charlotte, I had a lot of fear about starting a podcast.
Oh, yeah.
Like a lot of fear.
Yeah.
All these like things in my brain, my beautiful, like, love you so much brain wanted to tell me all these stories, made up all these stories about, why I couldn't possibly start a podcast. I mean, what a ridiculous, who would want to listen to you? Who cares what you have to say? All this nasty, mean stuff, right? And so I had a lot of fear. And you know what? I did it anyway, because I really do want to spread the message of courage to all the people in public health, because I feel like this is part of what we get to lean into so that we can create a public health that we really want, where we can create a public health that is, I love to hear people talk about what their vision is for public health. And I've heard so many different things, but, a public health that is truly rooted in equity, public health that is generous and kind And I mean, these are my vision, my values, but like, where it's really about people having freedom to choose how they want to live their lives and how they want to take care of their health, and like a public health where everyone gets to take care of their health in the way that makes sense for them. So, yeah, I guess that's one example of, me being courageous to start this podcast. And I could have so easily been like, let me do something else that seems easier, that seems less intimidating. I mean, of course, then I don't get to do the thing that I really want to do, the thing that's really in my heart. I could have listened to that fear, but no, I didn't. And you helped me. You helped me with that a lot.
That's helpful to hear. So I get it. Your vision for how courage could be helpful for public health and helped you move past that fear. I see that in a lot of our folks in public health right now. It's very scary to be in public health. There's a lot of fear around continuing in public health, but because we care so much about the people that need the services or the programs they're offering, it has people showing up, that pushing past that fear to keep showing up.
I mean, honestly, if I go on LinkedIn and I scroll through my feed, I'm like, courage, courage, courage. Like there's so much courage, and let's be aware of it. Let's be talking about it. Let's be sharing with each other how we get to be courageous. And let's make it a daily practice that is intentional and not just something that we happen to do, but don't actually, fully integrate into ourselves.
I think that's a great point, because then it gives us something, instead of counting all the things that are going wrong and are messed up, which we legitimately need to keep up with what's happening. It's so much of it, but we also need to keep up with how we're showing up and how we're winning, and these acts of courage, which will fuel and foster more of. So I think that's great. I like that. So that kind of connected both of them, that daily practice, because also seeing how, when you said that, I could immediately see someone going, well, I don't have time for that because I've got all this other stuff. But if we're constantly chasing the fires, we'll be exhausted and we'll never stop. But if we don't give some energy to these positive acts, which could help balance out the chaos, then, it's important.
And honestly, Charlotte, like I truly believe that is part of the approach of the people who are trying to dismantle public health. Let me tell you, they are intentionally taking action to create chaos. So all of the public health professionals are running around trying to put out fires, and we don't have the time, energy, money, we don't feel like we do, to actually figure out how to fight back. That is intentional. And that is the model of an abusive relationship. We are in an abusive relationship with our government right now, if I could be so bold to say.
Yes.
So it's super easy to want to go hide in the corner. And that's not going to get us out of this.
Absolutely.
So yes, we get to pause. I'm really big into pauses now. Like I take pauses in my life. I don't stop, but I like pause. And so we get to pause and feel, the grief, the anger, the sadness, the disappointment, all of those feelings. We get to feel those feelings, and then we get to fight like hell.
Yeah, this is exactly what you're describing. These fear, all of this that they're feeding us and wanting to fuel, if we can just use it as a catalyst to then take this action. Yeah. And you're right, we need to see each other and point to these things that we're doing really well, so that it can inspire our colleague, the next one, to do this thing or to step out. Yeah. Okay, well, I see, she's taking action to do this thing. Then, okay, well, I'm going to take this action despite my fear. I'm going to take action anyway. I'm little acts of courage in my life, in my walk.
I love to talk about courage is contagious. I have a t-shirt. I'm not wearing that. I'm wearing my courage t-shirt today, but I do have a t-shirt that says courage is contagious, and it's true. And so let's use that. Do we understand things that are passed from one person to another? Yeah, we understand that really well in public health. So let's actually use that to our benefit. Let's use it to our benefit.
Courage is contagious.
Courage is contagious.
Well, Kristi, I think this is absolutely wonderful. Obviously, I've been supporting you on this journey and really seeing the benefit, but I appreciate you sharing a bit of your fire and your passion for this and sharing this into context with our audience. I'd like for you to just share here also that you as a resource, like how are you being of service to organizations that are struggling with workforce development across the board in terms of public health? It could be trying to hold on to the people that you do have.
Yep.
Maybe it's really leadership. I think a lot about leadership. All of the leaders are examples of acts of courage just showing up.
Yes.
So how can you be of service for organizations and leaders who are really wanting to embrace courage and maybe even shifting the culture where they're at?
So I have developed a framework about courage in public health. And that's something that I can offer to organizations, public health organizations, organizations that are doing the work of public health, whether or not they identify as public health organizations. I think that's really important as well. I do workshop design, that's tailored to the specific organization, and then come in and facilitate the workshop, whether it's in person or virtual. And also, I can give keynote talks. Part of it is about helping people really understand what courage is and how it works. And certainly like pulling on the research that Dr. Brené Brown has done around courage. Like I absolutely have incorporated that into what I've developed. So it's about giving information about courage. And it's also, there's also a bit of like cheerleading, right? Like we need that. How do we tap into this? I have some pretty good energy around this, and I would love to share that energy with other people. That's what I do on my podcast, right? I share my energy with my guests. We get to share our then combined energy with the listeners. And I think that that's also really powerful. So yeah, let me come and share my courage with you and your staff and the people that you have in your organization. Excited to offer that.
Well, we will have links to connect with Kristi in the show notes, and I'll tell you how to get to that in just a moment.
Great.
Kristi, this has been great. I've enjoyed the conversation. Really appreciate you coming on and pouring into the audience. And I think it's been helpful to, maybe even starting with people recognizing the distinction between courage and bravery and how we're examples of that. And, I've circled several notes here, but, wrapping up with that. Courage is contagious. So recognizing what it is and when we're doing it, and then, doing more of that. And this is one thing we do want to spread.
Right. Exactly. For all the things that we don't want to spread, this is something we want to spread. We want to spread courage. We want to spread joy. I want to spread kindness. I think these are all things that honestly, our understanding of transmission we can apply that here as well.
I think this is also just what I hope to bring to this podcast audience is these resources and these opportunities to help us move forward, because we have a lot of work to do. We're still in this, and we've decided that, we are going to, honestly, at this stage, we have to rebuild public health. There's, remember in the early part of the pandemic, we kept saying we have to create the new normal. That's where we are in public health. So these are some resources, people that I've been bringing on the podcast are resources to help us as we continue this good work and to rebuild our system.
I would even say we don't have to rebuild public health. We get to rebuild public health. This is actually, I never in a million years would have wished this situation on us. And this is actually an opportunity for us to create something that was even better than what it was before, because it wasn't perfect. And a lot of people were still left out of the care and left out of the systems. So, this is where it's like, we also get to keep talking about what is our vision for public health, right? I think a lot of us there's a lot of overlap in the vision of public health among public health professionals. And let's figure that out, and then let's make it happen. We get to make it happen. We get to.
Thank you, Dr. Kristi McClamroch. I appreciate you.
Oh my goodness. So fun. Loved being here.
I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Dr. McClamroch and learn more about the work that she's doing. I also encourage you to listen to her podcast, Courageous Public Health. When you reach out to her, be sure to let her know that you heard her episode on this podcast. You can find the links to connect with her on the show notes page for this episode, which is episode 428. Just simply go to phecpodcast.com. Once you're there, you can navigate to episode 428 to find the show notes. One more thing before we go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals around the world. You can download our new PHEC podcast community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.